Shall we start? I mean, it's post-lunch, presume. So my first task is to keep you awake. And I think all of you are fully awake. I'm a neuroscientist, I'm a neurologist, I'm primarily a clinician. Sorry, I think you have put a... So basically, this day before yesterday, Professor Kunal, he had sent me a presentation about this topic, vital leadership, neurobiological insights. Frankly speaking, I had not much idea about this topic. Yesterday, I could just add some neurobiological perspective to this, and I'll share you certain things. You all are highly skilled, educated people. I mean, we come from different backgrounds. Leaders in any sphere, I mean, all of them have accountability, adaptability, confidence, creativity, and empathy. So, I mean, we all know these 5 points which are required for leader. Some leaders are born. Yes, we must agree that there are certain genetic factors which produces these born leaders. And you would know many examples of born leaders, despite of their, lesser educational background or level of skills. But institutes like IIM, they produce leaders. So leadership is also, this is learned behavioral theory of leadership, that you make leaders, you produce certain changes. So that is why it is so important, because in every sphere, it is so different, what leadership means. Let me put it this way. I mean, if any point of time I am not clear or I am not understood, please feel free to, interrupt me and ask me, since this is a very informal interactive session. Well, since I have been working with brain from last 2 decades or so, we know plant don't move, animal does move. She is my baby dog, Venice, So Venice is a beautiful baby dog. Whosoever comes to my door, she would, just run to the door as soon as she would listen to the bell. She would go there, she would bark. She would bark and she would bark, and then I'll follow, and she would smile at me. I mean, probably she smiles. Did I bark better than yesterday? Probably this is what she's asking me. I really don't know. But she has adaptability. Okay, if I'm not said, she would not, look at me that fiercely. So she would recognize my mood also. So she would adapt to situations. So she is also, in terms of brain, she is a, she has a new brain, which I'll be talking in later part of the talk. She has somewhat neocortex. She's a mammal. Okay. So an adaptation is required for survival, growth, and reproduction. But as a human being, we all need to store real and perceptual understanding of our changing environment, which is very important. So a leader should be able to predict the environment along with adaptability. So is the brain. So brain is the organ that helps in prediction also. Let me just put another example. You all are highly qualified people from IT background. See, and you come from different parts of the country. Maybe somebody who is in Delhi or somebody who is in Bhubaneswar or in Udaipur, they would have different assignment as a leader in your team. Since my background was, when I did my neurology, I was in a place called Imhans, which is in Bangalore. I was a teaching faculty there. My job was to teach, to train, and see patients. Simple. I was leading stroke unit. Stroke unit was, all those, paralysis patients. So my job was to teach there, to organize academic program, to treat patients in OPD. So my leadership was that at that point of time. Then I switched to Zurich for a couple of years for stroke intervention training, which was 20 years back was a new thing in the country and it was not available in our country. So I moved to Zurich University and I learned neurointerventions. I learned brain angioplasty, angiography, coiling, other things. At that point of time, my job was to look around, see how innovative. Indian perspective, we had fantastic teachers, faculties, clinical load is much better than Europe. So at that point of time, what I learned there was not only the technique, but the innovative way, because probably they have lesser number of patients also. So they are more innovative than us. They do more research work than us. So this was something, so my role was different. But surprisingly, when I came back to Udaipur, which is my hometown, 2 decades back, I had virtually no patients to do for neurointervention. You know why? Neurointervention deals with stroke patients. So, in very common terms, since you all belong to NIC, you have data for every state or probably for the country. In our country, or let's say in my state in Rajasthan, every year there is 1.5 lakh of stroke. Every year. Well, stroke means, just to put it very simple, paralysis, lakwa. So anybody who has facial deviation, weakness on one part of the body, speech change, be it comprehension or speaking. So that's a stroke. That's an impending stroke. This is brain attack, like heart attack. You all know heart attack. So stroke has to be dealt because brain is one organ. This is the master organ in the body, which is not apologetic. It doesn't regenerate. Your skin is destroyed, your heart is destroyed, your kidney goes. It regenerates with treatment, with time. And brain does not regenerate. You lose brain, it's gone forever. So the treatment for stroke happens because of what? Heart attack happens because of blockage in your coronary arteries, heart arteries, okay? Stroke happens because of blockage in your brain arteries. So there, any kind of blockage in your brain artery leading to paralysis, you have to immediately rush to a center where facility is available and you can remove the clot. So that procedure is called mechanical thrombectomy. Mechanically, you take the clot out. Technically, it's just 10 minutes job. In morning also, I did couple of cases. You go up in the brain with a small tube or catheter. You just see everything on the console. Take the clot out. If it has to open up, it will open up in 10 minutes. So that's very simple. So basically, the most important thing is you should reach to the right place within first 24 hours. That is the most important. So you can not only prevent paralysis, you can reverse it at many times on the table itself. Somebody who has zero power on that left side, he just improves on the table itself once you remove the blockage. Well, so that technically, I have learned the technique, I know about this. The problem was, in my state, even today, or countrywide also, everybody knows that acute stroke or paralysis patients. The problem specifically, there was no patients coming up, number one, because lack of awareness at that point of time, they did not do. I had to compete with renowned temples, then hospitals here, to bring patients in. Because in this zone, maybe, I don't know about others, but those who are from Rajasthan, we have temples where hundreds of stroke patients would stay for months and weeks together. Because the problem was, they are not to be blamed. Medical fraternity has to be also blamed for that, because there was not targeted approach for treatment of stroke in most of medical colleges or tertiary care hospitals in the state. So what was happening? Patients, because they had trust. So what happened at that time? 500 years back, there is a temple called Abri Mata, which is like 10 kilometers from Udaipur. 500 years back, stroke, lakwa, paralysis patient, they go there, they stay there. What do you have to get inside the temple? What you have to do? At many places you have bars, you have to sit and go. At some places you have to crawl and go. Okay? Sitting. So basically you are doing many physical maneuvers with yourself before you see the God. So this concept, this was physiotherapy. At least we are providing them. So 500 years back, the best type of physiotherapy was given to those patients which still exist there. Along with that, we have trust. So it heals and patients were recovering. So we need to understand. So here the problem was, so I started going to temples many times. Because in this particular temple I am talking of, initially they didn't allow me to do a camp. Later on, with awareness, when chief priest himself had stroke, he came to me and he recovered. So then they allowed me right inside the garbhagriha of the temple. And from then, we have been doing there very regularly, and we always try to, combine science with religion. there. So not to disrespect their sentiment, I always tell them, you come within first few hours to me, and later on I'll make arrangements for you to go to temple if you trust that way. Well, so this is real problem. So this is real 90% patients. There are certain temples where they registered, a lot of problems would happen, but the leadership here comes, you really have to be consistent. At times when we went there, our roads were blocked, they literally threatened us that don't interfere in, God's work. So these kind of things does happen, but a leadership role is you have to be consistent. You have to have that courage and consistently do if you think that thing is the right thing to do. So with that, the scenario changed. In Rajasthan, at that point of time when I came from Zurich, there was no stroke center which are doing this facility. Now there are at least 15 centers. Data which I was talking of, out of 1.5 lakh strokes per annum, 40,000 needs thrombectomy. Because we have two arteries in the front, two in the back, which supplies to brain. So major arteries supplying to brain are blocked, you need to open them up. It's very simple. 40,000 people needed it, and you will be surprised to know, if you can just check the data, stroke data, because stroke is the second common killer cause of death in our country. So maybe some of you would have that data. It is the first independent leading cause of disability in our country, paralysis. And I tell you, I'm not as professional or as expert as you are when it comes to data science. My prediction, I did a very simple calculation, if you agree with me, when 40,000 people needed it, and most of them are in the age group of 40 to 60 or 70. They are employed somewhere. In my state, average income is around 19,000 rupees. So a disabled person not only loses his work, he is homebound, whole family takes care of him. So there is a revenue loss of 10,000 CR per annum to the state. So instead of that, if we make mechanical thrombectomy free for every patient and create awareness about it, we would save that amount of money. So that is something, I request you maybe and how many patients we are doing per year in Rajasthan? Hundreds. If you talk of whole country, we are doing 2,000 thrombectomy per year. 2,000 thrombectomy per year. That's a very disappointing data. So the whole idea of, I'm not taking the talk away from, but I just want you to realize that this data is so important to be put up to the government, so that the biggest problem nowadays, patients do come to me, but the 80% refuse because of cost factor. It costs around 2.5 to 3 lakh rupees. Even if I make it very cheap, it will take at least 1 lakh rupees for the cheapest of the instrument with which I can do a thrombectomy, even if I don't charge anything, because these devices are made by multinational companies. So government can do a lot to save a lot of money, revenue, manpower, if we just bring it in the guidelines. In Chiranjeevi Ayushman, it is not covered as of now. So that's again a bad thing. We should, once we raise voice, probably it will happen in due course of time. Okay, fine. So just coming back to the topic, mechanical thrombectomy, stroke, this is very passionate thing to me, because 20 years I have been working on. So leadership in my case is something different. I have to really, okay. So a leader is not only a learner, but he has to predict it also. I am learning, I am still learning. I have learned my technique, I know my skill, I can do a job in 10 minutes, you can do your job in 10 minutes, but probably we need to have certain more skills. We are all skilled people, we are professionals, okay. So research consistently demonstrates that key factor distinguishing executive from successful one from unsuccessful one is their ability to learn from experience, okay. So one has to be mentally agile, they should be agile to people, to the change, to the results, and most importantly, they should have self-awareness. Okay, this time it went wrong, it should not do again. Because in any organization, what happens, as a leader of the organization, this is very important. For example, I run a department, I have like 50 staff working with me. If I create an environment of fever, productivity will go down. So a leader should be, it is not only we are giving directions, right direction, of course, that one should give, but we should listen to them, we should have empathy to them, and we should try to understand them. Only then, now I'll explain you the reasons why this fear factor doesn't work, how the brain, respond to them. I'll explain you. But before that, I just wanted to mention about this thing. Well, so now we come to the core topic, brain. Brain, fantastic combination of software and hardware. I mean, God created for us. So brain it's like, jelly-like organ. So there are two discs on two sides, connected in between, if you can see here. Do we have pointer here? Yes. Okay. So these are two discs connected by something called corpus callosum. So, okay. So this is when you're looking brain from above. Here, if you cut it sagittally from here, so this is what, these are the two discs you can see, and beneath this you have, so brain is, simply speaking, it is, forebrain, midbrain and hindbrain. So this is forebrain, and then you have midbrain and hindbrain. So I'll just go in more details, slight more details which are relevant to our talk. Well, so this is how it looks like when you see it externally, when you see it from outside. Because brain is really mysterious organ. I mean, you work with computers, but this is one of the best combination, the way God has created it. And it has put it in a vault, in the cavity, in a bone inside to protect it. Okay. So when you see here, so these are kind of, I just want to tell you some basic things. This is the front part of the brain, which is called frontal lobe. Well, this is something central sulcus, which is so important. It's a sulcus-like thing. And on the front of central sulcus, you have motor cortex. Any activity, any motor activity I am doing because of this. Okay. Any kind of touch I am feeling on my body is because of sulcus, which is sensory, cortex is there. So motor, sensory. Central sulcus is divided in two zones. Well, then you have, brain, which is a regional brain, which is frontal lobe has these parts, prefrontal cortex. Don't need to go in details of that. This part is parietal lobe. Parietal lobe is very important. I'll tell you why. This is the biggest area is parietal lobe, which is responsible primarily for perceiving sensations. Okay. But this is also called spiritual cortex. I'll tell you why in the later part. Well, and this on the back is our occipital lobe, which is responsible for vision. Okay. So brain has a networking. Brain has a lot of fibers. Brain has a architectonics. Well, we need to understand that brain is built along certain pillars. So if you want to understand brain, you have certain bundles. Let's say there are 4 bundles along with the whole brain is laid down. I'll tell you why this is important to know. Well, before we dwell into that, so sensory inputs, vision, touch, hearing, reading, writing, whatever. So these are sensory buffers. Then that creates a working memory for us. Working memory is something which you have learned over last few weeks, days or months. So that's your working memory. What you learned today, if you are able to recall, 50% of today's talk, let's say after a couple of weeks, then your working memory is good. And certain memory goes into long-term storage, which are for years and decades, and which never dies. Even if you have Alzheimer's disease or trauma to your brain, you don't die. You don't forget who was your father. So long-term memory is one thing. So based on your memory, you plan your actions and responses. Well, so this would be probably easier thing for you to understand. This is a coronal section of the brain. This is something like this. So you can see brain has a history of 500 million years of evolution. 500 million years of evolution. Your brain, my brain, it was not, created in a day or two. It was 500 million. I'll tell you, in today's modern neuroimaging, you know about MRI and all those things, you can see part of the brain, which are in fish, or reptile, or amphibian, and in us, we are Homo sapiens. So brain has evolved. Unlike any other organ in the body, I always take a pride that I deal with brain, because brain, unlike any other organ in the body, heart, you have just increase in the heart, whether it is an amphibian heart or a reptile heart, your number of cells and size has increased. Same function is there, it's pumping. Kidneys are doing same, filtering function. So again, number of nephrons, size, shape, increase. That's all. Brain has evolved. No other organ in the body has evolved as the brain. Well, so I told there are 2 discs, right and left. So right brain work like more parallel processor. I mean, you know it better than me. And left brain work like more of serial processor. Parallel processor, serial processor. So left brain is involved more in logic, executing functions, while right brain is more of, imagination, innovation, big picture. As of now, we are sitting here, everything is, in harmony, it's good, everything looks fine, pleasant. Our right brain is probably more active. Income tax once I go home, or I have this problem to be sorted out for my kids, the left brain starts working, and that creates problem, unpleasant sensations also. Well, then as I said, this is again same thing. So this I was telling, there are 4 bundles. This is we call cingulate bundle, this is circular bundle, and this is parieto-occipital bundle. So along with that, the whole brain is dead. So why I'm trying to tell you this, I draw a line from this cingulate sulcus to ascending limb of circular sulcus to descending limb of circular sulcus to parieto-occipital sulcus, and I complete this, everything inside is old brain. That's like 500 million years old brain. So why I'm trying to say, you can see that brain, and that is why it is important, for leaders or for any disease per se. This has a importance in knowing history, evolution, embryology. So basically, everything inside is old brain, everything is outside is new brain. So, and this is basic structure of brain. So you have a lot of networking and brain also works on electrochemical signals. Okay, and this is nowadays we can see these fibers in the brain. So this is diffusion tensor imaging, and this is standard MRI imaging. Well, if I go further, the first brain cell emerged in ocean, in seawater. So that is the brain of primitive fish called Amphioxus. So this was first neuron surrounding ocean water, seawater. So this was the first brain cell, which was in fish. It evolved over a period of time. Archipelagium. Archipelagium is oldest brain. I will tell you why. Because in brain, there is, because this would be slightly difficult to grasp. So I'll just tell you one thing. See what happened 500 million years back. The brain was working like archipelagium. The function of archipelagium we still have today with in our brain, but archipelagium, or what is popularly known as limbic system, which consists of hippocampus, parahippocampal gyri. So basically that's limbic system, which is associated with emotions. Okay, even before that, if you see what happened, something called, I show you here, there is something called hindbrain, where you have 2 things, brainstem and cerebellum. If I can go back and show you again here. So why I'm trying to say, this is reptilian brain, and this is important to know. These structure, this is brainstem, okay, and this is cerebellum. So this part of the brain constitutes reptilian brain, which is a territorial brain. You go to a snake, you encroach in his territory, he bites you. That's his job. That much he understands. So some boss are like that. You go in their territory, they will just scold you and turn you out. So that reptilian brain is probably more active. So that's Macklian theory of evolution of brain, which is more important because we have those traits. So that is how these traits, which are already there in our brain, how do we modulate them? How do we, balance them? That's most important thing for becoming a true leader also. But we need to understand a reptilian brain of the snake is evolved from brainstem and cerebellum, and just they have a function that they maintain their territory. Okay, so then you have a reptilian brain, then you have a limbic brain. Limbic brain, which is archipelagium, which is also present. So a dog would take care of a dog. So animals take care of their offspring. So they are emotionally attached with we are also emotionally attached to our friends, family. So we have active limbic brain. So limbic brain is one brain which enhances your emotional quotient, empathy, compassion, ability to understand your colleagues, your juniors, your seniors. So that's very important trait to have, because any leader should have not only IQ, you are all genius IQ people. You are all, you are scientists, ERF level people. So your IQ is, I don't need to, measure your IQ. It is going to be, better than anyone else. So you are all, IQ is genetically determined. Plus you did some efforts, you studied, you worked in your project, you enhance, you sharpen your skills. So IQ is more or less fixed. You would not have become an NIC officer if your IQ was so low, even if you would have studied very hard. I mean, let me be very honest in this thing. So IQ is something you can just enhance compared to EQ. EQ is emotional quotient. Okay, because emotional quotient is IQ multiplied by W. W is wisdom, compassion, empathy. Simply put it in mathematical terms, EQ is either 0 or 1. Either it is there or not there. There are certain scales where you can actually measure EQ. So there is scoring of EQ also, but one should have an EQ, a good EQ. So your 1 EQ would make you a good leader, or 0 EQ would definitely put you in trouble at some point of time. To yourself, to your office, to your colleagues. Well, so EQ should be 1. So this simplest definition of emotional quotient, and emotional quotient is high when you have a compassion, empathy, ability to understand and listen to your friends, colleagues. Okay, fine. So limbic brain. So reptilian brain, limbic brain, which is archipelagian, old brain. Over the period of time, then there is something called, if you see here, this big structure is coming up. This is a basal ganglia. So basal ganglia is basically one part of the brain which is involved in reward. Okay, you have to sometimes reward, punish. So these kind of activity are governed by basal ganglia, which I'll again come back later. But this evolved, which is subpelvion, archipelagion, paleopelagion, subpelvion. And most important thing, which is important to understand, that we all human being had this. I told you everything outside that was. So outside brain is all neopelvion. Pelvion means brain, new brain. So we Homo sapiens will have this new brain. So not everybody will have. Okay. So we would have this neopelvion, and precisely this new brain or neopelvion is responsible for our abstract thinking, logical thinking. Okay. It gives you problems, but that's what logical thinking is all about. It gives you insight. So this we Homo sapiens, that is why we are able to do much better than any other species on this earth. Okay, so this new brain is relatively new brain. Territorial brain, then a limbic brain, which is emotionally governed brain, then a neopelvion or new brain. So this evolution of brain so this is 5 million years back only, this new brain. Okay, neuroscientists presume that still brain is evolving. So we don't know where it is going to be, let's say 500 years from now. They say it is evolving in the back. It is going, further our, skull would distort at point of time, and this will evolve here and will require some more traits in times to come. Well, but unlike computers, which you work with, Miller's law suggests human can process limited amount of information at once. One overwhelmed with too much information, distraction occurs, leading to decline in performance. So, as a leader or as a project in charge, if you give one project to your junior or colleague, 2 projects, 3 projects, but if you give more than 5 projects, it's going to fail. Human brain already has more than 6,000 thoughts coming up every day. More than 6,000 information are giving, whether you do nothing all the day. 6,000 information here lying in the bed, because you would be, thinking about family, work, something would happen to your brain. 6,000 impulses are already going to your brain. So you are just, this is over and above what you are giving to your colleague. So human brain, and that's why, let's be very practical and scientific. Many big leaders are unmarried. Major part of the brain problems are gone. So that increases their productivity. It's simply difficult to beat them, because their brain can process things which are only relevant to their work. Rest things are gone. So productivity is better. So scientifically it's, but that's how it works. All the big leaders in the country. Well, so fearful brain. So this is, as I said in the beginning also, our brain instinctively reacts to threats, and sometimes it overreacts. Actually, this happens. Fear inhibits learning and innovation. When employees are afraid of making mistakes, they are less likely to take risks or challenge the status quo. That will retard the growth. Mistakes are often concealed. Despite what manager may say, staff often feel pressurized to cover up errors due to fear of repercussions. That's a normal brain tendency. So fear creates risk-averse culture, causing employees to hide mistakes rather than learn from them. So this environment has to be, this is brain instinct. So you really have to take care of this. That's why I was saying, listen to them, understand them, have empathy, and I think overall team's productivity would increase with that. These are 3 responses for anyone to have, immediate responses. Either something is thrown at you, you are sitting in a board meeting, either you fight, you put your point assertively, you explain, you insist that this is correct, or you don't just talk and quickly leave the hall once meeting is over, that you just don't want to mess up and you just want to flight. Or sometimes you become overwhelmed that you are frozen. Oh, what to do? You really do not understand what has gone wrong, what went, and you have no idea practically. So that's a frozen state of brain. Well, so these 3 things. So that's how do we defrost our team member's brain or our brain? Sometimes you have to defer decisions if you have doubts. Sometimes great leader helps their member to learn and grow, listen, understand them, give direction, and shield them from organizational chaos and politics. And this leads to better performance. Well, so brain, I'll skip some of these. Well, you must have heard about these 2 happy hormones, serotonin and dopamine. So these are, the dopamine and serotonin, they have, like serotonin, which is, something written here, sprinkler, this ventral tegmental area of the brain, it produces serotonin. So what happens, and there is another, so basically this area in the brain, and there is one called dorsal raphe nucleus in the midbrain. Sure, please. So these areas, they produce serotonin and dopamine. So the important, serotonin is a hormone which is involved in your mood. You're happy, you're sad. Most of the antidepressant works, they are serotonin reuptake inhibitor drugs. So they increases your serotonin level and you become happy. However depressed, I have this tool that I can increase your serotonin level. But you can do it better in your food also. There are certain serotonin containing foods also. Those who are non-vegetarians, they may take fish, eggs. Vegetarians can take nuts, spinach. So there are some food items which increases your serotonin and really you don't need to take. So for leaders also, diet is important. I'll come to this point again. So basically serotonin and dopamine. Dopamine is a hormone which is involved in reward mechanisms also. So I will skip this details of these pathways because these pathways would provide these 2 hormones, and these 2 hormones are very essential. Practically dopamine, food are also there. I mean, the more or less is the same what I told about serotonin containing foods. You do a meditation for 12 weeks. This is dopamine. This is just to see that whether dopamine or serotonin levels are increasing with meditation or not. Because that is something I'll tell you how it works actually. So this was just to see that it increased. So what happens over a period of time, certain times you do certain activity on a routine basis. You have some rituals, some good habits, some productive habits. Then you do it every day, you do it repetitively, and it becomes your habit. So these are the areas in the brain, basal area, which is like curator, amygdala, ventral striatum, and you start getting reward. So this circuit, in Hindi we call it, कोई भी कार्य रोज संपादित करें, संस्कार डालें पहले उस कार्य को करने के लिए, पहले संस्कार, फिर कार्य, उसके बाद वो आपका आदत बन जाएगी. ये जो सर्किट है, rituals to routine to habit, this is by this circuit. Well, so this is what it is. Once it becomes habit, you do it at less conscious level. I mean, you really don't work for it, it happens. You consume less energy. So this is what has been depicted here. So this is very important in any team or at any workplace. Ritual, routine, and habit. This needs to be developed through what I was telling about the basal ganglia circuits. Well, stress or distress, these are two different things. Many times we talk stress. What stress is? Some amount of stress has to be there for brain to work. It is a task, but it should not translate into distress. And basically, it is, you really need to have, I'll come down, once you are healthy, then only you can perform. Health means not physical health only. Physical health, mental health, social health, and WHO has now added spiritual health. So 4 parameters, if you are fulfilling, then you are, doomed to become a good leader or a good person or productive person. I mean, 4 spheres. So it is important. Some of the things, and in your age or in my age, simple things you can do. Don't eat too much sugar, avoid all these things, smoking, sedentary lifestyle. So these are doable things. And this is just how it will have more productivity. So this is what I was telling you about. Health is not merely absence of a physical disease. So you have to attain these 4, domain of health before you are doomed as a fit person. How to do that? We all have heard about, this was again very close, neurotheology. Spiritual, how to explain spiritual aspect scientifically? Neurotheology. It really works well. The problem here is spiritualism per se. It is very helpful. I'll tell you in next few slides how does it help in increasing our productivity. But spiritualism, if you take Western definitions, spiritualism means there are some empowered person जो बात कराते हैं मृत व्यक्ति से किसी की. Spiritualism Oxford Dictionary में वो मतलब है. They are specially empowered people. So that is not the Indian context. So for us, spiritualism is जो अध्ययन से आत्मा का परिचय कराए उसे आध्यात्म कहते हैं, और आत्म परिचय के विषय को अध्ययन करना ही आध्यात्म है. तो आध्यात्म का बेसिक जो है कि हमारे अंदर वो प्रेम, शांति, खुशी और विवेक लेके आया जीवन में. So what happens with that? You are happy at individual level. You ignore small family problems. Your family is happy. Once you are happy at both levels, you go to office and your workplace become not only a daily core to earn money, but a joyful place for yourself, for others also. So that is how spiritualism will help you. So it is, well, this again, I was wondering how to, whether somebody is happy, how to know by simple blood test. Somebody would say sugar, this, that. I simply found that something wrong in the problem. This simple test, HSCRP, you get it. Something is problematic in your body. It will just tell you this. Where, what, no idea. If it is normal, everything is fine. Okay. Then selfie plasma DNA. DNA is inside the cell. If you have higher selfie plasma DNA in your blood. Okay, in COVID time, we started doing this project. So DNA we could measure in the blood. If it is very high, it means your cells are also getting necrosed or getting damaged, and it is liberating DNA outside. So this is just, this is again I have put up for a publication that these 2 things will tell you whether you are healthy or not, instead of sugar and all these things, because those are parameters. This is actual reflection on the body. Okay. Well, just to put it again, a 19-year-old college boy, he had acute onset left-sided weakness. I have time now. He reaches to a district hospital where this kind of CT scan is done. The main artery in the brain is blocked. He is paralytic. His HSCRP is very high. So this is artery is blocked, which I was telling earlier. It takes 10 minutes to open up this artery. And once you open this artery, you take the clot out. So basically, this is the clot in this test tube. And this clot you subject to something called next generation sequencing or metagenomic analysis. So this is very interesting thing. Sometimes what happens, someone who was absolutely fit, doing gym every day, no smoking, no diabetes, no blood pressure, fit, fine person, he dies on treadmill. He has a heart attack, massive heart attack or stroke, and he dies on the treadmill. You must have heard these things. So is there anything other than all these things we are always, emphasizing hypertension, cholesterol, diabetes, sedentary lifestyle, smoking, and many people are doing everything and they are living fit and fine. I'm not advocating any of these things, but there is something other than that. So the whole idea was we retrieved this. So this was the first publication we did in the country, We retrieve 27 bacteria in the brain thrombus, which is a sterile compartment. So from a sterile compartment, because culture will not pick up these bacteria. So it is NGS. You pick up every single DNA, bacterial DNA. So with NGS, we could pick up 27 bacteria, and these bacteria were not something big, virulent bacteria. They were living in and around body. We know about them. Something is sitting in our oral, mouth. Somebody is in our gut, on the skin. So remember, hygiene is very important. Dental hygiene. So these bacteria, I'll not go in detail how these commensals means those are living with us. Commensals means those are sometimes good also for us. But these commensals at one point of time over the years can cause you some heart attack or stroke. So Vidra is what we proposed. That lack of hygiene is one of the risk factors apart from this. So this is, I will not go in details that how do they produce stroke or heart attack. This is already published. Somebody who is interested can see that. Well, so this is, and then comes, okay, I have a blockage in my heart artery. I know it. I have a blockage in my brain artery. As of now, I'm fine. One fine day I may end up with this. See, what happened? I realized in 2 decades of my practice, somebody who has 30% blockage in heart artery or brain artery, he has a stroke or heart attack. Somebody who is having 99% blockage lives whole life. This has happened. I know about this problem. So basically, it is the plaque or thrombus inside your artery. What you do? If it is a raw plaque or thrombus, it will throw clots in your brain. So what we do is normally, if it's a mild blockage, we don't do anything. Just put them some aspirin, cholesterol medicines, BP medicines, and these things. Okay, that's a standard practice world over. Or if it is increased, you put a stenting, angioplasty. You put a stent across that raw area, and just endothelize the vessel and make it healthy by putting a stent, which is invasive procedure. You do angiography and put a carotid angioplasty or coronary stenting. You know about that. Neurotheology tells you that we have a super drug in our home. Neurotheology taught me because you have meditation, you have asanas, you have pranayam, then Ashtanga Yoga mein you have one important food is sacred foods. Turmeric, haldi is in. We consume 5 gram haldi in most of our households every day. Some of those who are shifted to fast food may not do those. So basically, turmeric is a super drug, but unfortunately, it is not part of allopathic medicine. It is not written in allopathic. There is something called curcumin in turmeric, which is active ingredient, which is so useful. It is a super drug. Why? It is anti-inflammatory. Number one, it is antioxidant, used for cancer also. But all that in our Ayurvedic literature. But unfortunately, and I'll tell you other properties of antimicrobial, antifungal, so many properties. Why it is not used, why it is not marketed, why it is not sold? Because there is no research, you don't have data. So that's why, so data is so important. As a data scientist, we will understand that we need to have data. Otherwise, we lose all our medicines. And there is, all the Ayurveda, allopathy, all these are not working in collaboration also. There is right from the top leadership, there is no effort to make them, together. So that's a different point. But then I realized, we started doing, because haldi wala doodh was not a difficult research project. Otherwise, if I have to do a drug trial, it is very difficult to take, DGCA permission and all those things. When I was doing this trial, I did in 500 patients. I was giving the bed, patient lying on the next bed will also tell me, mujhe to wo haldi wala do. Because we have the trust also in that haldi. Haldi is a strong anti-inflammatory medication, and inflammation is happening in your heart arteries, in your brain arteries, and you are not giving any anti-inflammatory drug. So that's the caveat I thought over the years, and I realized the haldi. Then I did this plaque imaging. I did MRI of these 500 patients before giving haldi at baseline. Then I did again after 4 weeks, as early as 4 weeks. Most of these plaque healed, without putting a stent. So this is a wonderful drug, probably, and this is published in one of the leading stroke journal in the world in stroke. So basically, this is why I want to share with you. It's a very simple thing. You can just put in your diet, and maybe some of you can be benefited by that. If you're a healthy person, just put 1 teaspoonful of haldi in your milk. Don't buy medicines, okay? And sprinkle with some black pepper. Because haldi, what happens? We take haldi wala doodh, and it just gets out. 99% is excreted out, okay? So for increasing bioabsorption, turmeric milk has to be, black pepper would increase bioabsorption by 2000 fold. Okay, so that will work. The curcumin will get into your blood and it will protect you from diseases. So for a normal person, but for a diseased person, obviously the doses are higher.
And the ratio of turmeric and black pepper?
Yes, I would say sprinkle of black pepper. If you are putting 1 chammach of haldi, 1 teaspoonful of turmeric with a sprinkle of, because for me it is 500 milligram is to 1 milligram.
Okay.
But that's for curcumin. Curcumin is active ingredient. Either you extract curcumin out of haldi, turmeric, but then you have to take as a medicine or a pill. Okay. But a simple guiding thing is take 1 glass of milk, 1 or 1.5 teaspoonful of haldi, but haldi should be good quality. And those you can find out where is the good quality haldi is available. And just sprinkle that with black pepper.
And the time and which time we should take in the morning or in the evening or any time?
Whenever. So whenever it is convenient.
How frequent we can take the haldi wala doodh?
See, you can take, the 1 time or 2 times. 2 times is perfectly all right, or 1 time at least, because most of us are not able to take 2 times.
So we can take with water also?
No, there I come to point. Yes, very relevant. Actually, what happens with turmeric, it is not soluble in water.
Okay.
Even in milk, when we have a toned milk, that packaged milk in our home, so the toned milk has no fat or very less fat, and it is not soluble in that. So your milk should have some content of fat to make it soluble. Otherwise, it will not pasteurize. So milk will not help. Milk with some fat content. Normal cow's milk or buffalo's milk is the best milk.
Skimmed milk not should be used.
Pardon?
Skimmed milk not should be used.
No, because that will again, it will not be dissolved, and it will be just either it will stick down to your glass or it will be just out. So it is not dissolved. So fat, some amount of fat has to be. It is not water soluble.
It will help everybody, or somebody should take precaution if anybody having the blood pressure problem or any other.
Okay. So basically, it is a blood thinner also.
Okay.
Okay. Somebody who has a bleeding tendency, somebody who is already bleeding tendency, so he should not have it. Somebody, but haldi, as far as I know, in 500 patients or whatever literature I have seen, it does not have any serious side effects. Some people are not tolerant, they have GI intolerance, some gastritis or something may happen to some of the people. But in my studies, it was hardly less than 1%, people who had GI intolerance. But yes, serious side effects, I would say bleeding disorders. Somebody who has active bleeding disorders.
One more myth in our Punjab that opium is also used during the brain stroke. Opium also help in dissolving the clot.
No. Opium is bad actually. Opium will be detrimental.
It is commonly used in Punjab.
No. Opium has it has an abuse liability, plus it has a sedation. You will not know in any disease whether the disease is producing drowsiness or opium is producing problem. So opium is absolute no. Opium is discouraged. Nowadays we don't have opioid drugs also. It is completely banned.
We have to cook the turmeric or just dissolve?
No, just put it. Just put it and just dissolve it with a spoon. So, I think, so this is what you were asking, 500 milligram plus 5 milligram, and this is what I was saying that we have 8 limbs of yoga. So these are very important for any health. So once physical health, doctor like me, psychiatrist will help. For social health, your family and friends will help. For spiritual health, our ancient, 5,000 years old. We don't know whether it originated with Shiva or with Patanjali, but very old, thing we have. So everything is mentioned here. Not only so components of that, I'll give you that module also what we use in our. So this is what it was. Okay. So this all thing Ashtanga Yoga will have. But what we can do in daily basis is asanas, that's physical exercise, meditation, that is dhyan. Then you have pranayam, that is breathing exercise. Okay, 3 things, and 4th thing is your food part. So this will keep you healthy. This is interesting thing. I did this seminar with Shivani ji. So neurotheology, because this is, one side when we propose this as a specialized science in the country. So we called all the neuroscientists across the country along with Shivani ji, and this was it. So I felt that 90% of our diseases are psychosomatic in nature. Some kind of psychosomatic problem is happening, headache, pains, this, that. And our brain usually works 10% of its capacity. So if I ask you that with your whatever salary you get, you just take home 10% of salary, would you be able to do okay? Really doubtful. Unless until you are sadhu or fakir. So if you are working with 10% of your brain, how you can encounter all these diseases? If you increase your brain efficiency, let's say to 70-75%, most of the diseases will not happen. And how to do that? Neurotheology, spiritualism, no medicine for that. So basically, so this is what, and this is yoga and music intervention to reduce depression, anxiety, and stress during COVID outbreak and healthcare work. I must, this opioid thing, when COVID time was there, I was going to hospital and on the roads, nobody was there, only police friends were there, and they were also distressed, and they really do not know. Doctors at least knew that what is problem, what is not. In the beginning, we also did not know. But later on, we realized there are some medicine, this precautions, but they really did not know. So they heard that alcohol can keep COVID. So alcohol se bahut sara. So they used to say, "Hum alcohol le le kya?" And some of them were consuming alcohol on duty just to kill COVID. Otherwise, they don't do it on duty. So basically, so we did this project, yoga and music intervention to reduce depression, anxiety, stress during COVID-19 outbreak. So this was a study which was published in King's College London, and it does really help. I'll tell you how. So basically, I think I'll just go for 5 more minutes, maybe. Because this is conscious brain, logic, imagination. You know, these are interesting things. You are a logical person. You are an imaginative person also. But when there is a conflict between logic and imagination, what wins? You would say, I'm a logical person. I would work with logic. It doesn't happen in real life. If you are fearful of flying in high in the sky in flight, or you are afraid of going in dark, आपका कितना भी logic काम है, dark में nobody dies. Flight के crashes बहुत rare होते हैं. But अगर है, तो नहीं है. So this is a problem, or this is a fact. Sorry, not a problem, a fact. Imagination usually wins over logic. So that is the conflict between conscious brain and subconscious brain. One must understand, and that is why people like scientists or technocrats, or we have always, we are people with logic, and we have always lost to people with religion, and so they always win over. So that's a fact in the life. If you look back in the history, scientists have lost their lives to religious people because that works more. Well,
Sir,
so this.
Sir,
I'll just finish it quickly, then you can just.
One question, please. There is ambiguity between the conscious mind and the subconscious mind. Can you define it?
Yeah. So basically, yes. Subconscious mind, conscious mind is when I was talking about neocortex.
In layman language, we think that when we are awake, we are conscious. When we are in a meditation, we are subconscious mind.
Yes, I would say conscious mind here refers to a logical brain. Let's say going in dark. If somebody is afraid of that, can you give a logic to him? You go in dark, nothing will happen to you. It's our home. Everything is scrutinized. Nothing, no problem is there. So that's a conscious mind area that things are imbibed and ingrained on the part of the brain that you will not do. You have no explanation for that. So that's your subconscious mind. Where you do things without logic is your subconscious mind. It is not unconscious. So don't confuse it with conscious and unconscious. It's subconscious, which happens automatically. You are not, somebody is coming, a snake will bite. Subconscious mind is trained to bite someone if somebody encroaches in a territory. So that's his brain trap. He doing it subconsciously. We human beings will not do that because we have a conscious mind or logical mind taking over that subconscious mind. Okay. So basically, IQ, we talked about that, which is like serial processing, left brain. Okay, EQ, which is emotional quotient, which is like your parallel processor, which is your right brain. So left brain, IQ, genetically fixed, problem solving brain. Right brain, emotional brain, relational capabilities with others, it is not fixed. You can increase it or decrease it as per environment and training you have. And the highest form of intelligence is spiritual quotient, SQ, which is again difficult to achieve, but that can be achieved. When right and left brain work together, they are working in synchronicity, then you achieve SQ, whole brain. So once a leader start, utilizing and become a yogi, and he uses whole his brain, then his output and performance is absolutely at different level. Now, how to increase your SQ? How to increase your spiritual quotient? Higher the spiritual quotient of a person is, you have, better peace, satisfaction in personal life, family life, and workplace become a place of joy if you have a big IQ. So you develop this quality of compassion, joy, love, energy, creativity, and peace. Well, I ventured into neurotheology by this accident. Actually, one of the time I was treating a young male, and if you can see here, he has a tight blockage in the artery, here and here. I just opened up the artery, this in cath lab, and I was very happy and I did a good job, and he was shifted to ward next day, and suddenly this young boy, and one of my friends from Bangladesh was here at that time. So this young boy was telling something like Ami Khusro. I could not understand. I thought it is some kind of jargon speech he is having. And jargon speech is known in brain problems. So, but he was saying that he is speaking, "Mujhe bhook lag rahi hai, I'm hungry." So this I could not understand. I referred to papers also, but I did not find very valid. He never lived. He is a person from the tribal area of Baspada here, and how did he know Bengali? And he spoke few words in Bengali. I really don't have any explanation. Well, so science and spiritualism are different things, but still every religion will have spiritual component in them. Whether in Jainism they have this, supreme forgiveness, or in Sikhism, I will not go into religious detail. In Islam also there are 5 pillars of Islam, and one of them, the Sufi, is actually spiritual component through Quranic teachings. Yoga got into popularity in US. I mean, it was known in India, but when they had a lot of smoking problem there, so they started using this Hatha Yoga, and it really helped. Yoga in Vietnam, this monk these are the real pictures from the newspaper. He was burned alive because of some problem with the king, and he did not cry or mince a word, because probably yogic abilities were to that extent. So these are the two things. Christianism also, I mean, this Saint Teresa famous movie where she told about 4 stages of ascent to soul. Mystical experience does happen. Now, scientifically for me, sometimes I will not go in details of that. I tell you one very simple thing. I told you in the beginning, we have this parietal lobe. Frontal lobe, parietal lobe, occipital lobe. The temporal is here. Temporal is memory. Broadly speaking, parietal is, I told you about sensations, sensory brain. Frontal is your logic, executive function, those things. Occipital is for vision. Parietal lobe is responsible for self-world dichotomy. That means you are sitting there, I am here. So I am oriented to time, place, and person. So this is time, place, person. Orientation is a function of parietal lobe. Okay. Well, suppose by doing some meditation or exercise, I suppress my parietal lobe to the extent that I lose this orientation to time, place, and person, and I feel I am actually in you. This happens in highest form of meditation, when you lose self-world dichotomy, और जिसको बोलते हैं ब्रह्मांड में विलीन हो गए. Then, at the same time, that yogic exercise has networking, connection, parietal lobe have slowing down, your frontal lobe, it lights up. You have more concentration, logic increasing at the same time. And third thing happening at that time, your limbic system, I told you, concerned with emotions, which is limbic system is here, near the temporal lobe. So there is immense outspurts of these dopamine and serotonin, happy hormones to your limbic system, and you feel that kind of joy and ecstasy, which some people say कि वो सांसारिक सुखों में कोई मजा ही नहीं आता है. So that kind of state you get in with this kind of meditation if you do it even for 12 weeks. I'll show you a study for that also.
The best way of meditation is.
Pardon?
There are hundreds of ways.
I'll tell you. And so this is how I can prove as a neuroscientist that this is spiritualism. How does it work? I have 3 tools. I have MRI, functional MRI, which can actually tell you real-time changes. This is called EEG. When somebody has this happening in your brain, it's a simple EEG, which is very simple thing. Bedside EEG, you see changes. Then you have MRI, then you have psychometric testing, where you do IQ testing and all these things. So with that you can know whether some kind of meditation is producing, I told you, intensity. And last thing was permanency. Something is producing permanent changes in your brain or not. That is what we need to see with meditation or yoga. Well, so this is, I'll skip most of these. This is our, as of now, probably you are more in alpha state. Normally when we are working, we are in beta state of mind, which is this activity. Alpha is when you are doing meditation and yoga, more and more alpha. You have theta and delta sleep waves. Okay. So this is what I was telling. So basically, now, if you see here carefully, what happens, this is parietal lobe, sidewise, I told you. So on a more red is here and there is less red. So after meditation, it becomes parietal lobe goes down, it sleeps. Okay, this is attention area, your frontal lobe. Okay, it is more red here. So this is lightening up with meditation, and this is after 12 weeks of, not one day, 12 weeks. Okay. Verbal prayer, you have, I'll just skip. So even some people are atheists, they don't follow any religion. But if you don't trust something, things are even, I'm not trusting it, but still I am worshipping God. So in this study, when an atheist was done, there is no change in the brain. If you don't trust it, you do a meditation or yoga, whatever, if you are not trusting it, it will not happen in your
Sir,
brain.
monk normally Buddhism maximum practice the.
Yes, there is the enlightenment, to what they call
They are
enlightenment.
more brainy,
No,
they are more brainy.
they are more peaceful and happy.
most peaceful.
IQ, daily IQ. Somebody is genius or idiot, he may be a low IQ person, but he will be more happy,
Happy.
more peaceful, more
More
happy
peaceful.
with himself, with surrounding. So this Kirtan Kriya Sata Nama, Sikhism, they do it. Simple thing, this project was done in Alzheimer's disease. This is not my study, it was published in US. So with this Satanama, their memory improved. I will not go in details, they did a SPECT study of these patients. So neuroscientists are of the opinion that spiritual experiences are not just the result of contact with the divine, mind it, but rather effect of the electrochemical elements interpreted by our brain. So this is, one opinion. So, and this is all the, since being a data scientist, how does it work in brain, the whole, this flow diagram is there. This is our own study of more than 1,000 patients. This is the module, you can have it on the YouTube also on my channel. This is 1 hour module of yoga meditation. So this is how what we gave to these subjects. These were the results: depression, anxiety, stress were less. Family relationship, 95% better, 5% worse. This is a difficult thing. It's less, but why did it become worse? I can just speculate. Okay. But health, fear of death, purpose of life, religiousness, spirituality, most of the things were better, except by and large, family relationship and workplace productivity was also good, better. But 5% and 4% are the figure where you should be cautious. This is the same published paper, and I think I would finish here.
Sir, one more question, sir. Is the, one theory that if you are working through left hand, then both of your brain are working and then you are more conscious, as normally said the USA president, 60% of the US president are lefty. So it is true?
See, multi-linguistic and multi-hand approach. If you work with both hands, it is good. Because what you are born as a right-handed person, okay, you are doing everything with right hand. So you are born as you are doing, but if you have started using your left hand, so
then
what
your other brain also works.
other brain you are stimulating, and when you are stimulating on a repetitive basis, obviously that will become a better brain. So all the imagination or other qualities will improve. So you work with both hands, it will definitely increase your brain capacity.
So testing method only for IQ test.
IQ testing is, we have many scales for IQ testing, but normally what we do, because we have Indian version, Western version was bachelor's adult intelligence testing. In our country, many people would not know wine and breads. So their testing would have their elements. Okay, so we have developed our own testing. So there is an Niman's battery also.
So is it any free tool available on the
No,
internet?
sir. This one and one. The best battery is 2.5 lakh rupees, which is available in Department of Psychology. It cannot be copied actually. It cannot be put on net. They have many small things, objects, tools, drawings. So that's it. That's maybe you can put it
Sir,
some.
do you agree with that? People say that Einstein has better IQ than others, the quotient IQ. But
IQ is genetically determined, as I said. Okay, IQ is genetically determined. You can increase it by practice or reading or experiences. But it really does not change significantly. If you have a feeble-minded person, born moron person, he will not become genius.
yes.
Okay, so IQ, 100 IQ, like most of us would fall in 90 to 100 IQ. So that's a normal IQ, 90 to 100.
Normal people say that everybody has the IQ and he is better in one or any field. We say that some person is dumb, some is intelligent, normal people. But he has one skill in which he is excellent.
Yes, but I think that yes, you have certain traits. As I said, innate leadership, they are born leaders. I think because as a born leader, if you are born in a family of politicians, you see everything, you experience, you repetitively see, you become confident. So confidence, clarity, many things come, maybe Not even at genetic level, it will come from experiences you had from the early childhood. So, yes sir.
Sir, as goes on increasing, why memory become like that?
Age increases as the age increases. Yes, sir. That's a myth actually, sir. Partly yes. Because see, there are two schools of thoughts. Neurons. We have 100 million neurons in our brain. Okay, we are all millionaires by birth. So 100 million neurons in our brain, and they degenerate over a period of time. So let's say after 60 or 70, neurons do degenerate. But what happens if you have if you are predisposed to some degenerative disorder like Alzheimer's disease? Alzheimer's disease, your neurons will degenerate faster because of some problem. In Alzheimer's, neurons degenerate because of some disease to your neurons. Okay. But for a normal person, it happens partly because of after 50 or 60, what happens? It is not the degeneration of neurons which is leading to memory problem. It is because after 60 years, once you are retired, 60, 65, you stop using your neurons. The problem here is either you use it or you lose it. So you are not that interactive, you are not doing that kind of work. If you are active till 80 years of age, you will have good memory. Okay, you had a head injury or something, that's a different problem. If somebody is not having any degenerative dementia, which is disease, then for a normal person at a later age also, he can have a good memory. So sir, basically you need to use it so you don't lose it. But what happens after retirement? People will sit home, they would confine themselves, so धीरे-धीरे वो भूलने लगते हैं.
But so normally happen होता है कि हमारी memory अब हमें लग रहा है full हो गया. We are not able to easily refresh the things. Learning appetite low हो गई है. वो
Mean to say, don't sit idle, involve in activities.
Pardon?
Don't sit idle.
Yes, that's very important. Physically, mentally, you should not sit idle. Physically, you should idle, your musculoskeletal system will degenerate. Mentally, if you sit idle, your neurons will degenerate. It's as simple as this. Sir, what you are asking that मेरा कम हो रहा है. So better sir, आप क्या करें? देखिए कई बार क्या होता है, it is more of perceived thing than reality. What you do is, now for this, there are an online MMSE score. There is something called mini mental status examination and something called MOCA score. So that is freely available on internet. You can self-administer it also and see your memory. And I am sure your memory will not be less.
Have you seen an increase in Parkinson and dementia in the last couple of years? Or were these diseases earlier also
Sir,
there?
I think, sir, see, part of that probably could be because of our lifestyle, which is changing. But I think more and more we are picking up actually. So we can't say that it is increased. But I think it is better diagnosed. So you have more number of,
Better diagnosis and
yes.
early
So you
detection.
can pick up early also. If today I see a Parkinson disease has 3 problems: tremor, bradykinesia. So basically he has tremors, he walks with slow posture, and third thing is he becomes rigid. He blocks and block he walks. Okay. So these 3 things comes very late. Let's say a few years after the onset of disease. But nowadays you have better modalities. You just need, I'm very tired these days, I'm fatigued, and you just do some testing and do imaging and you pick up Parkinson early. It was not possible earlier. Now DOPA scan and all those things were not there earlier. Both ways. Most of them are genetically predisposed, but they will have it later age. So they are genetically predisposed. So it has a genetic element also to this. But yes, Alzheimer also nowadays it is being researched so aggressively. There are medicines which can, if not reverse, it can at least slow down the progress and give a good quality of life.
And what about dementia?
Dementia is a broad term, dementia means impairment in your cognition, in some of the faculty, whether it is memory, abstract thinking, emotionality, whatever. So dementia is a broad term. Alzheimer is a type of dementia. Okay. Parkinson disease, if it has a dementia, then we will call it Parkinson disease dementia. But Parkinson patients usually do not have dementia, like memory problems in the beginning. They are more motor problems. There's a problem basal ganglia. I was talking about the curator. So Parkinson, if they have dementia are many kinds. So these are degenerative dementias, where forgetfulness happens, like Alzheimer's disease, frontotemporal dementia, Lewy body dementia. So these are progressive in nature. We have some dementias which are reversible, like somebody is actually very common B12 deficiency dementia. If you are not eating B12 well in your diet, you are a strict vegetarian, you will have dementia. Okay, so that is you supplement doses of B12 and it recovers. Somebody has dementia because of infection. You treat infection, it will recover. So nutritional dementia, they are recovered. So you need to, there's a fixed, workup for dementia, that this is the type of dementia, this is the prognosis, this is the medication, and this is the outcome.
So what is the major cause of the depression these days, according to you?
Depression. Very difficult question. It varies. I think it's very difficult. Depression.
Earlier, we don't, in childhood, we have never heard about the depression, but these days it is very common. Every 1 or 2%
अब
is
तो
the family is
मेरे को
depressed.
लगता है कि because see, if I actually 9th क्लास के बच्चे को भी डिप्रेशन होता है, मुझे बहुत एंजाइटी हो रही है एग्जाम से पहले। मेरे को ये लगता है कि एंजाइटी जो 9th क्लास के बच्चे को जब वो आप काउंसलिंग करते हैं, आप और हम भी 10th क्लास का बोर्ड एग्जाम देके आए थे ना, उस वक्त तो कितना एग्जाम एक के बाद एक होते थे, पढ़ाई करते थे, नंबर आते नहीं आते जो भी। 10th क्लास के बच्चे को देखो एंजाइटी हो रही, डिप्रेशन और काउंसलर के पास ले जाना पड़ता है, उसको काउंसलिंग करानी पड़ती। तो हम क्या कर रहे हैं, अच्छा बेटा रहने दे, तो मत कर, अपने 10th के एग्जाम में कोई बात नहीं, फेल भी हो गया तो कुछ और कर लेना, मत कर। हमने बच्चों की रेजिलियंस कम कर दी है। हमारे माँ बाप एक थप्पड़ में डिप्रेशन दूर कर देते थे, मतलब बट एक थप्पड़ लगता था, ब्रेन सर्किट सब झंझना जाते थे और पढ़ने बैठ जाते थे।
So depression is not a disease.
और दूसरा अवेलेबिलिटी होती थी पेरेंट्स की। डिप्रेशन इज
Depression is not a disease.
Lifestyle.
लाइफस्टाइल, यस लाइफ, आई वुड से लाइफस्टाइल इज रीजन। चाहे वो फूड हैबिट्स हो,
हाँ.
आप सारे एसेंशियल इंग्रेडिएंट तो छोड़ के फास्ट फूड खा रहे हो, बाहर का खा रहे हो, जोमेटो कर रहे हो, तो एवरीथिंग इज चेंजिंग ना। आपका न्यूट्रिशन, जैसा आहार वैसा ही विचार, वैसे ही मन होता है, तो वो सब बदल गया। फैमिली न्यूक्लियर फैमिली हो गई है, जॉइंट फैमिली में पहले डिप्रेशन के लिए बच्चे को टाइम नहीं होता था, बच्चा अकेला है घर पे।
एक्सटर्नल एक्टिविटी जो डिक्रीज हुई है सर, बेसिकली
बिल्कुल, आउटडोर एक्टिविटीज कम हो गई।
ओवरथिंकिंग पे कॉल है, ओवरथिंकिंग, आज सोच रहे हैं कल क्या होगा, वैसे क्या
वो मैंने बोला ना, ब्रेन वायर्ड ही वैसे ही है। ब्रेन हमेशा ओवर एस्टिमेट करता है रिस्क को, ब्रेन ओवर रिएक्ट करता है, कल ही हो जाएगा, जबकि उतना खराब होता नहीं है। ब्रेन वर्स्ट सोचता है पहले, वो ब्रेन का नेचर है, इंस्टिंक्टिव नेचर है। वहां पे आपका वो जो लिम्बिक ब्रेन है ना, बहुत ज्यादा एक्टिव हो जाता
सर
है।
मोबाइल के साइड इफेक्ट अकॉर्डिंग टू यू ऑन ब्रेन?
मोबाइल के साइड में सबसे पहले तो यू टेक लॉट ऑफ टाइम, योर प्रोडक्टिविटी विल गो डाउन।
वो तो है ही। नॉर्मली वन थिंग इज दैट एप्पल हैज द लोएस्ट फ्रीक्वेंसी, सो दो वो ऐसे बोलते हैं, एप्पल से दैट ही हैज लोएस्ट।
ऐसा नहीं है, एप्पल, आईफोन, ऑल मोबाइल्स आर सेम।
मैं पैसे पूछ रहा हूँ, पैसे पूछ रहा हूँ, मोबाइल के साइड इफेक्ट्स ऑन द ब्रेन
तो सही रहेगा। All is well, all is well.
Mobile, sir, I mean, mobile is, I think, we were better, we were more productive, we were more, peaceful, more happy. Mobile has stopped, social health कम कर दिया। अगर हम उस पे जाएं आगे, physical health, social health, spirituality का तो टाइम ही नहीं मिलेगा, सोचने का ही टाइम नहीं मिलेगा, करना तो दूर की बात है। तो मोबाइल is actually changed our life. आप लोगों के लिए बेटर हो सकता है, पर बच्चों के लिए खराब है। मतलब at your age, I think you can probably make some balance in your mobile use. We are 40 plus. Not for kids, they are exposed to the worst in the world, and then how do you expect them to be the same child as we were?
Thank you, sir.
Thank you.
सर आपकी प्रेजेंटेशन से शेयर होगी ना?
हाँ सर,
ये शेयर द प्रेजेंटेशन
है प्रेजेंटेशन है, ठीक है सर, we'll try। मैंने को दे हाँ हाँ फिर आप मेरा नाम डाल के YouTube पे देख लीजिएगा, फिर दिनों बाद क्या सकता है। ठीक है सर, हाँ एक तरफ बढ़ जाता है, स्ट्रेस हो जाता हाँ श्योर ना। आप मेल कर दीजिएगा सर मुझे।
मेल आपकी सर इनके IIM की वेबसाइट पे है।
हाँ वो है इनके पास।
ईमेल भी बता देना।
ईमेल
बता दो, मोबाइल नंबर बता दो पहले।
जनरली जो आइसोलेटेड पेशेंट प्राइसेस होता है वो 3 महीने में बच जाता है। किसी किसी में रहता है 5-10% लोगों का ना बहुत सीवियर होता है, वो लिटरल जैसा होता है जो ठीक होने जैसा नहीं है, उसमें फिर किसी किसी में असर रहता है, बट बेटरमेंट हमेशा होती है। वो सर 90% में तो पूरे लेवल पे जाता है।
लेवल ही लिखते हैं सर।
बट एक्सरसाइज और मेडिसिन जो आइसोलेटेड बेस पर है कारण उसका है वो डिजीज को ट्रीट करना है। मतलब बेस पर के भी कुछ रीजंस होते हैं। एक होता है नॉर्मली इसमें कोई रीजन नहीं है, वो ठीक रहता है। तो कोई इंफेक्शन है, कोई सार्कोइड है, कोई ट्यूबरकुलर है, तो वो फिर उसको
ईमेल बोल कॉन्टैक्ट शेयर कर देता हूँ। शेयर कर ग्रुप में नहीं डालना यार, परेशान नहीं करना, परेशान नहीं करना। नोट कर 001
पहले से कुछ चला आ रहा वो दिमाग में पहले से